Today we are going to discuss how to perform a central line dressing change on a client, and your checklist is going to be in WebCT like the others are, and we are going to take it through a perspective of the nursing process. So we're going to talk a little bit about what you need to do prior to going to your patient's room, and then I'm going to give you the demonstration. So an assessment component of that, again, you want to look at the patient's medical history to see if there's anything in there that can be a flag to you about any focus assessment that you need to perform before you go into the patient's room, so you know what equipment you need. You need to look at when the central line was placed. What is the reason for that? If there is any issues with the line itself, for example, if there's any ports that they are clamped because they're clogged, or there's some reason or some specific way to administer fluids or to draw blood from that line. How long has it been in there? That will be for the date. Any key points that the nurses from a previous shift that already performed that dressing change have noted into the nurse's notes. So you want to make sure that you at least go to the last one and read them and see what it is. And of course, you want to know what type of central line you have. There are many different types, and we will go through those specifically during the lab time. But the one that we have in here that Ms. Shapiro has is a triple lumen line. So it has 3 ports that you can use to administer medications of fluids. So it has a distal port, a medial port, and a proximal port. And that will be important for you to know in regards to administration of medications and things that are compatible with or not. But we're not going into all those details. I'm just going to show you how to actually clean it and change the dressing. So what do you need for that? Remember that this is a line that is placed into a large bore vein, and a vein that can carry organisms, and is a high risk for infection. So you want to make sure that that you're not breathing over it when it's exposed, that the client is not, or anybody in the room that wants to stay in the room while you're doing this is not exposing the client. So therefore, you want to make sure that you have masks with you. The important thing is that your client has to have a mask, you have to have a mask, and everybody in the room that stays have to have a mask as well. And that is for infection control purposes. You will need a pair of clean gloves to remove the old dressing, and then you need your central line dressing tray, and that's going to have everything that you need in here. So as we go into the patient's room, again, you already have gathered all that information from the patient's medical record, nurse's notes, etc. And you come into the room, you introduce yourself to your client, you verify their name, their armband, and do a general survey of the site. And that's when you're going to come in and you're going to take a look around the dressing. Is there any breaks in the skin from the dressing? Is there any little ulcers or redness around the site? Do you feel and you touch around the site, and to want to make sure that there is no crepitus, there's no fluid underneath there that can indicate that there's infiltration. You're looking for redness, for swelling, for tenderness, and that will be more phlebitis. It's an infection right at the site. So you will perform that assessment before you take that dressing off. Next thing will be that you're going to then, after you explain the procedure, you're going to mask your client. So you're going to put a mask on your client. With Shapiro, I'm going to put a mask on you. Now, if the patient has a trach, then you want to make sure that you also have that the oxygen device has a closed system, that the client is not breathing through it and kind of exhaling microorganisms around the site. And then you will be wearing a mask as well, which I am going to put on so you see it. Okay. Then you're going to have your clean gloves on. And you're going to remove your dressing. The way you're going to remove your dressing is by peeling it off from the corners. You got to be very careful about not pulling the skin of the patient, and you want to probably just hold the skin taut, and then to pull the dressing away from the skin. and you want to gather in the middle of it. You want to pull in, holding the skin taut. All right, as you carefully peel off the dressing, it has a gauze over it. So you're going to take a look at the gauze, and you're going to look for any drainage, color, consistency, anything that just doesn't look, right. And you're going to put it back into your glove like we did before. You're going to remove it the way we did before. I'm going to throw it into the red bag. And you're going to do another inspection, because at the beginning you just kind of felt around it. You didn't actually look at the site. Now, with the dressing off, you can take a look at the site, look at the sutures, and you can see and look for any signs and symptoms of infiltration or phlebitis. Okay, so now we're going to come over here. We're going to prepare our kit. This kit in here already has the gloves in here, and it has another mask, but I already have put a mask on to take the other dressing off, so I'm just going to put it on the side. And I'm going to open the packets the way we were taught, away from you, side to side, and towards you. And you have everything that you need in there. And remember about the borders. So I'm going to come over here. Okay, let's go ahead and put our gloves on. Make sure that you do not cross that with your sterile feel. Got your gloves on here. You're shaking your thumb, grabbing the other ones. You have it above your waist. Okay, now you can have both hands inside here, and you can rearrange everything you have. You have the big tegaderm that covers the whole area. You have one alcohol. We have one ChloraPrep. We have an extra gauze, a split gauze too, and your label. Okay? So the first thing that we're going to do then is to use the Chloraseptic. You're going to grab both ears and you're going to break it. I'm going to shake it, and it actually covers the whole pad. Now you notice that you only have one pad, okay? And this is my dominant hand. Once I leave the field, I can now bring this back into the field. And this hand is going to stay in here. So here we go. You're going to start from the inside, and you're going to go into circular motion, and you're going to go and you're going to clean, and you're going to discard. Now, what happens is that now I have excess in there, as you can see. So I'm going to use my 4x4. I'm going to bring it to my 1-inch border. That means that this part of the gauze is not sterile anymore, but neither is my hand. So I'm going to grab it with that within my 1-inch border. My hands remains in the same place. I put it on top and I pat it dry. I haven't contaminated anything. Pat it dry, remove, discard. Now we're going to use the split gauze. The same principle. Once you come across the field and you get into your 1-inch border, that part is contaminated, you grab it with your finger, stay hand here, coming back over there, put it on top. That stays right there. Once that is covering the site, you can put both of your hands together, because that is covered and you don't need to be sterile anymore. You're going to be using now your tegaderm, and because it's so large, you need both hands. So you're going to come back in here. You're going to remove carefully the tape. Then you're going to make sure that you cover the whole site. The same thing we did for the IV. Remove this part. Okay. I still want to save this because it has the little tape where you can put the date, the time, and your initials. So you put it on the side for a minute. You remove your gloves, same way we had done it. Put it inside, wrap it all up, put it into your red bag. At this point, you can remove your patient's mask, remove yourselves, put it into the red bag. Today is September 3rd. It's 1 o'clock in the afternoon, and my initials. And I'm just going to peel it off. Put it in a place away from the site. Make sure that everything is well. I'm going to get all your trash. Put it in there. And then you are going to make sure that the patient is comfortable, that the rails are up, the bed is in a low position, cold light is in place, everything is hooked up the way it should be, and the patient is comfortable. So that's how you change a central line dressing change.